G'day guys, Smith City here for Smith City Product Reviews. Well, look at my tooth. Last night I was thinking about making tacos and then just instantly had a craving for dumplings and some spring onion pancakes. So I got Uber Eats delivered and I bit into a crunchy part of the spring onion pancake with my front tooth, and I was like, whoa, that's really crunchy, more than what I thought it was. And then I'm like, whenever I'm eating, sometimes I'll play around with my teeth just to make sure that they don't chip. And sure enough, yeah, the crunch was actually my tooth. So we'll talk about how that has occurred. When I was 12, I was at my friend Jake's house and my folks were there, sort of just having a night out there, and they were probably having some drinks or whatever and just enjoying themselves. And we were just being kids. We're in Jake's room playing Murder in the Dark, and so if anyone doesn't know what that game is, it's you basically turn off all the lights in a room at night and you hide, and you have to basically, someone is the person who's trying to find the people that are hiding. And so, smart me, just like instantly before playing that game, but we're talking about, I'm like, I know exactly what I'm going to do. I'm going to pull out his sliding chair in his under his desk, and I'm going to go under his desk and pull the chair back in, and like literally, there's no way I'm going to be found. No way. And so, anyway, the lights are off, and I sort of like find my way to that area, pull the chair away, and I go under the little gap of where the chair is, and I don't go down far enough, and I just go bang straight into the wood. And where this chip is, it actually goes a bit higher, so it's like a bit higher is where they repaired it last time. So I wouldn't be surprised if I don't get seen soon at the dentist, that this might be even further up. And then on this side, it was also, so it kind of like went in a V shape. And so yeah, this last little cap or little fill of tooth that I had is probably like 9 years ago now. So probably the last year I've been always, well, I wouldn't say anxious about it, but I've always been thinking, okay, when is this going to go? When is this going to go? It's probably going to go. It's probably going to go. Last week at work, I was eating something quickly at work, and just the what's the word I want to use? The silly man that I am was eating, I think it was some form of salad with something else in it, and instead of just eating it like a normal person would, I bit down into something that doesn't need to be biting down food wise, and I just hit the fork really hard. And so as soon as that happened, I'm like, I reckon I've done some issues here, and I'm playing around with it with my tongue at the back, and I'm like, nah, it's fine. But after that, I'm like, I reckon it'll go soon. And so, yeah, last night, dumplings, chipped my tooth, because this one is also done, and there's now a gap between, like, protecting the side of it. I'm worried that it's going to go. I have two lovely, I don't like calling my personal training clients, but my people that I train, two people that I train, Jeremy and Vanessa, their brother, Vanessa's brother works at a dentist. So on Monday, I'm going to try to book myself in and get this done ASAP. There's no pain when I breathe in because there's no nerves, because obviously the chip was higher originally when I first did it when I was 12. So there is that, but it's weird. I've got a bit of a lisp going on. It's weird to talk because of the angle. The end part of here is a bit sharp, so I might get some lip issues. I don't know. But I'm basically going to get off this recording, and then I'll come back after I get this tooth done, and I'll do a little bit of a review on my dentist experience of wherever I get in. So, see ya. So the moment of truth. I've just finished from the Western Road Dental Care with Miles, fix my broken tooth, and the lovely Justine behind the desk and Miles' assistant. They were absolutely fantastic. And here it is, guys. They did an absolute fantastic job. All repaired nice and neat. It feels pretty smooth on the back. Feels pretty smooth at the front. They've done a pretty good match up in terms of one of my teeth sitting a little bit more forward than the other. And all in all, pretty quick experience. Probably was in and out of the chair within maybe, I don't know, 10, 15 minutes, if that. They did an absolute fantastic job. Justine, like I said, behind the desk was an absolutely lovely, friendly person, which going into a dentist, I'm not one to be scared of a dentist, but there are some people that can be, especially little kids. And I think if you've got someone behind the reception desk who's actually like a calming influence, that can directly impact how the patient would go into a procedure. And so with Justine, I feel like if, let's just say, there was young kids getting their teeth done and they're worried about like drilling and noises and stuff like that, just her demeanour behind the counter is something that probably could lower someone's stress and anxiety. So Miles, you've done a top-notch job, mate. And I'll obviously be going back to see you guys for a routine checkup in September. But you've done a really, really good job. Great stuff.